Welcome to the deep dive. Today, we're really getting into something critical, how public health policy gets made. Specifically, we're looking at the research behind it. Can we actually trust it?
Yeah, it's a fascinating area.
We're focusing on a study that looked into, well, predatory journal citations popping up in official policy documents. Our mission here is to understand how research is chosen, how it's checked, and importantly, how maybe less trustworthy stuff sometimes slips through. This really matters for health policies that affect you.
Absolutely, and it goes beyond just academic debates. It's a real public health issue. So first off, what are these predatory journals? The study defines them pretty clearly. They're basically outfits more interested in making money than in good science.
Okay.
They might promise fast publication, but they're often not transparent, and crucially, they skimp on quality control. Think little to no real peer review, where other experts check the work.
Right, that critical vetting step.
Exactly. And the scale here. Well, an earlier study mentioned found over 1,200 policy documents citing just one group, OMICS publicity.
No, 1,200.
Yeah. And OMICS is widely seen as predatory. They were even sued by the U.S. Federal Trade Commission. That number alone suggests this isn't just a minor issue. It points to a potential systemic vulnerability.
Okay, that OMICS figure is genuinely shocking. So if this research is, potentially unreliable, how does it actually end up in these important policy documents? Because these documents are crucial, right? Decision makers rely on them. They can't be experts in everything.
Well, ideally, policy documents should lean heavily on systematic reviews. These are really the gold standard, rigorous, thorough ways of looking at all the existing research. But the reality, the study found developers are often under immense pressure.
Like what?
Tight deadlines, not enough resources, the need to produce something fast. And this often pushes them towards, let's say, less rigorous methods, like narrative reviews, which are quicker but not as comprehensive.
Okay, so it's a trade-off sometimes. And the study mentioned how people evaluate evidence. They talk about quality versus trustworthiness.
That's a key point, yeah. Participants distinguish between quality, meaning, is the study well designed? Did they use solid methods, maybe checked with tools like Amstar or Prisma checklists?
Methodological rigor.
Right. And then there's trustworthiness, which was more about the source's reputation. Like, is it published in a journal found in big databases like PubMed or Embase? The brand name, essentially.
Right, the perceived authority.
Precisely. And here's the catch. While people said they prioritize quality, in practice, there seems to be a heavy reliance on that brand recognition. There's this perception that big databases have, already filtered out the bad stuff.
Which sounds reasonable, but...
But the study found that's not always true. Some predatory journals do get indexed in these major databases. So that sense of security can be, well, false.
And it gets even more complicated, right?
Yeah.
Because many developers know about predatory journals, but they're not sure how to spot them. The study mentioned looking for red flags, like grainy-looking pictures and spelling mistakes, or using lists like Beale's list.
Yeah, exactly. It's almost like quick detective work. Some even felt that, if only one citation out of maybe 80 is predatory, it doesn't really matter that much.
That seems risky, relying on gut feelings or visual cues.
It is, and here's a really crucial finding. Untrustworthy research isn't only found in predatory journals. This isn't just about avoiding the obviously bad publishers. Even highly reputable, legitimate journals, the study mentions examples like The Lancet or the New England Journal of Medicine, which have had retractions, can sometimes publish unreliable findings.
Okay, so just avoiding known predatory names isn't enough. The problem is broader.
Much broader. It makes assessing trustworthiness a much bigger challenge than just checking a blacklist.
So given all this, what can actually be done? Did this study offer solutions?
It did offer some key recommendations. First up, transparency. Policy document developers really need to be clear about how they found and assessed their evidence. Even if it was a quick ad hoc process, they should document it and state the limitations.
So explicitly saying, look, we did this quickly, so be aware.
Pretty much. That honesty helps policymakers understand the real strength or weakness of the evidence they're basing decisions on.
Makes sense. What else?
Second, better training and resources are needed. We need to get practical tools and guidance into the hands of these developers. Things like the directory of open access journals or checklists like Think, Check, Submit can help them better distinguish trustworthy sources from potentially unreliable ones.
Right, empowering them with better tools for the job. This whole deep dive really underscores that good public health policy requires constant vigilance about the information it's built on. It's not straightforward.
not at all.
So, thinking about this, what does it all mean for you, listening? It pulls back the curtain on the complexities behind the health information and policies you encounter. What we've uncovered today shows that finding trustworthy information isn't as simple as just avoiding bad actors. Even top sources can have issues. It suggests that critical thinking, asking questions, and yes, digging deeper is something we all need to do, especially when it comes to our own well-being. Keep asking those questions.